Ladies and gentlemen, I am Dr. Vivekanand Giri from Central TB Division. I am a public health specialist by training, and today we are going to discuss about the services of under NTP. So first one is the universal health coverage and social protection. Till now we have discussed about the modality for the diagnosis, modality for the treatment, DRTB services, then HIV, TB and the ICT based adherence. Then now the next part, which is core importance for the TB patient, is universal health coverage and social protections. Till now we have discussed about the various supportive mechanism, but one more important thing, that is out of pocket expenditure or the catastrophic cost to the patient. So how this out of pocket expenditure is identified? That is the cost of diagnosis, cost of treatment, cost of travel, cost of nutrition, and to avail these services, to avail the treatment, the wages lost. So this is in turn a 5 different element basically for the contribution for the out of pocket expenditure, and program has inbuilt some mechanism for addressing this issue, so that one of our target in NSP is pertaining to the out of pocket expenditure. So reduce the out of pocket expenditure. For that we have the cost of diagnosis. Now the program provide access to the free diagnostic test through its networks of the lab. So all the TB services in public setup or in private setups are free of cost or on the subsidized rate. The program will extend free diagnostic services to the patient seeking treatment in the private sector. So here the mechanism, NTP basically provide support in terms of logistic, in terms of consumable, in terms of drugs to a private provider, so that the cost to the patient can be reduced. Then cost of treatment, program provide free access to medical practitioner, drugs, treatment adherence mechanisms. That means program has linkage with the private practitioner with the help of certain mechanisms. PPSAs are there, and with the help of that program is providing different free access to the medical practitioner in terms of drugs, treatment, adherence mechanisms. Then it will also put place in system to reimburse the expenditure borne by eligible patient in private sector. Sometimes the private sectors will incur certain cost, that cost will be reimbursed by the program, so that out of pocket expenditure can be reduced or the cost to the patient will be reduced. And it has been observed that around 60 to 70% of the people for primary care, the first contact will be a private sector. So private sector play a crucial role in terms of initial diagnosis and treatment, and these are the different intervention by which program is basically providing support so that out of pocket expenditure can be reduced. Then what are different financial support to the TB patient? Financial support to TB patient, program has started Nikshay Poshan Yojana in 2018, in which the patient has been given rupees 500 per month till the treatment is ongoing. Then program is basically providing the transportation cost in terms of say example, if the patient is from the tribal area, rupees 700 as a one time travel cost given to the patient, so that his adherence and the compliance can be improved. Then catastrophic expenditure like loss of wages, different schemes are ongoing by the state governments or a different local health body, so that different social schemes will address the cost incurred for the different loss of the wages or different things. Then ensuring e-payment beneficiary under NTEP. So TB patient, treatment supporter and private practitioner. So here the three different component, one is the patient, second is the treatment supporter and third one is the practitioners. As all of us are aware that now most of the DBT, that is a direct benefit transfer, is linked with the Aadhaar. So, and we have one software in which a recording of the patient's diagnosis, then his particularly monitoring of the treatments and his outcome of treatment. So we have the NICSHE portal. In the NICSHE portal, the entire database of the patient is there. So linkage of the NICSHE with the Aadhaar and Janadhan Yojana, this is one of the important Jana Trinity in which the patients, the benefit from the government to the patient directly to his account will be credited. So there will be a seamless transfer from the government setup to the patient's account, so that this cash benefit will help the patient for improving his nutrition. So nutrition will improve the outcome of the patient. Then notification of all TB patient in the NICSHE. So all cases, irrespective of the whether is a government patient, is a public patient, or the private patient, or any other set of patients, patient has to be notified into the NICSHE. And for notification, Government of India has made certain gazette notification in which it is mandatory to notify the TB case. On particularly this mechanism will also ensure the treatment supporter, because in NTEP the person who basically provide the treatment to the patients, who basically monitor or supervise the drugs given to the patients, is the treatment supporter. Treatment supporter can be either ASHA, treatment supporter can be any member from the community, or treatment supporter can be any member from household also. So government is providing the treatment supporter incentive for the that particular person who is basically providing the medications. Then next is private practitioners. So private practitioners who are particular linkage with the programs is getting the monetary incentive for the notifying the TB cases. So in turns, program is ensuring that notification of the particular tuberculosis happen in the proper way. So reaching the TB patient in the private sector. Just now we have discussed that most of the particularly health services are contributed by the private sector. So private sector play a crucial role in terms of providing services to incorporated the different private services in the program, so that the notification and the services provided to the patient can be aligned with the program. First one is about the care of all TB patient as per program guidelines. For that we have STCI. STCI guideline basically deals with the standard of the standard for TB care, which will be unique in the entire country. That is the standard for diagnosis, standard for the treatment, then public health responsibility and social inclusions. These are the guidelines which is basically issued in STCI, so that all the private practitioner will follow the particularly standard regimen, standard diagnosis, and all the services. For that we have the bunch of the particular private providers in terms of NGOs, private practitioners, and medical colleges. Earlier it was said that around 30 lakh, estimated that 30 lakh new cases there in per annum, and we prior to COVID we used to particularly notify cases around 24 lakhs to 25 lakhs. So this missing million portion is much reduced. To address this missing million will be possible only when we address the private sectors, and private sectors will be addressed through all these standard diagnosis, standard treatment, then the public health responsibility and social inclusions. For TB notification, the first particularly notification of TB, the OM was issued in May 2020. Then the next OM was issued on 21st July 2015, in which initially it was for chemists, then it was for lab, and then practitioners. So overall overall all this mandatory notification issued by the government of India, so that TB is a notifiable disease, and any person who is particularly diagnosis in TB case has to notify that case to nearest health facility, so that public health action can be taken. Any defaulter particularly who is unable to notify that case, certain penal provisions are there in IPC, but these are the penal provision is basically some sort of just to make the people aware. It is the purpose of this is not to take action on the each and every person, but TB notification is mandatory, and as per IPC it is some penal provision is also placed person who is not notifying the case to the healthcare facility. Then what are different modality for the TB notifications? So TB notification is as simple as it can be through SMS, it can be through WhatsApp also, it can be through email also, or it can be through one-to-one persons also. Here the details most important, we have to have the details in terms of the patient's name, age, sex, then the complete address, then patient's mobile number. Nowadays patient mobile number is very crucial, date of diagnosis, then date of treatment initiation, site of the disease, whether it is pulmonary or extrapulmonary, so that after treatment there are certain public health action which is supposed to be taken by the healthcare worker or healthcare facility, so that actions can be taken and patient can be brought into the NICSHA, and different support in terms of free medications, in terms of social supports can be given. So these are the different modalities for the TB. Then as in earlier our presentations also we have discussed about ICT surveillance and monitoring. So direct benefit transfer is there, that NICSHA Poshan Yojana, in which patient is once the patient is diagnosed, the contact details of the patients, then Aadhaar details and the bank detail of the patient is taken, and that is seeded into the NICSHA, so that amount is transferred to the PFMS to the patient's account directly. Then patient tracking, say example somebody is working in a particular place for the some employment reason or certain reasons, over a period of time again he has to switch over to his native place. In that situation the person will get his entire treatment from the place where he is shifted. So the patient tracking, then provider engagements, then digital transmission of the results. So we have inbuilt mechanisms with the labs. The most of the labs are having the linkage with the programs and the NICSHA, so that if any sample is tested positive, it will have the direct linkage with the NICSHA. So digital transmission of the result. Then logistic management of the drugs are provided free of cost to the all public patient as well as the private patient, and there is a proper logistic management at the state level as well as at the district level, so that there should be uninterrupted supply of the drugs and drugs can be managed properly. Then entire surveillance mechanisms, so that the what are the different patterns or change or different disease burdens, or how these schemes are properly working, and the different mechanisms are in place. So for that program has the surveillance mechanism, so that the inputs are given and the timely action is taken. Effort to engage private sector in tuberculosis. As we discussed earlier that the private sector is play a crucial role. It is 50 to 70% of the particularly healthcare facility, healthcare services are provided by the private sector. So the NTP or erstwhile RNTCP was the first program who has identified the significance of private provider, and right from the inception of the program itself, the program was having certain strategies in which there was an alignment with the private sectors and engagement of the private sector. And one step going ahead, that is the private provider engagement through PPSA and PPM schemes. So here on right hand side you can see the three different diagrams in which the three different intervention was planned, one in the Patna, second was in Mumbai, and third was in Mehsana. So here, before starting the intervention, the very minimal number of the notification was coming through the private sectors. Then certain intervention was there. Then with the help of this PPSA, that is patient provider support agency, and the public private mix schemes. So these are the different schemes by which the diagnostic and the drug services free of cost or subsidized cost given to the private practitioner, so that the patient will be retained there, patient will get the services, drugs, and with the free of cost. Then empowering patient through the honorarium or the social welfare scheme, that is NPY, and different schemes. Then implementations of H1 across the pharmacies, druggist, and chemist. As per Gazette notification, for every chemist it is mandatory to maintain the prescription of the particular TB patients, and he has to inform to nearest health facility or notify that particular patient to nearest health facility. So involvement of pharmacists, druggists, and chemists for schedule H1 monitoring is very crucial. So what are the different key messages? Key messages at the end of this presentation is, first one is TB is curable. However, adherence to the treatment is very important. Why it is important? Once the patient is not properly taking the treatment, possibility that he may end it with the particularly treatment failure, or sometimes there will be recurrence of the disease, and then possibility that he may end it up with the particular drug resistant tuberculosis. It may be MDR-TB, it may be XMDR-TB. So adherence of the treatment is very crucial, because the drugs, the first line of the drugs, the cost is different, and for the MDR-TB the cost is also different, and most importantly outcome of the treatment for DRTB is different than the first line of drugs. So it is very important to have the adherence to the treatment. Then free drugs and diagnostics are available in NTEP. So NTEP is the one program which basically providing the quality diagnostic and uninterrupted drug supply to the TB patient, whether it is public or whether it is private. Then standard diagnostic algorithm treatment protocol should be followed. So for government or the public sectors, we have different algorithm already, and the same algorithm with the help of STCI, that is standard care for tuberculosis in India, that gives us the document which is basically providing the standard treatment, standard diagnostic algorithm, and the standard medications. So there will be uniform pattern over public and private. Notification of TB is mandatory. As per Government of India Gazette notification, the TB is mandatory in all states and UTs, whether it is private practitioner, public practitioner, chemist, druggist, or lab. It is mandatory to notify the TB to nearest health facility. Then addressing the social determinants like nutrition, housing is also important, because TB is not only disease where person is basically taking the treatment and over. It is something he require nutrition, he require social support, he require counseling, or there are different social schemes run by the different government, so that his issues related to housing, wages, or social inclusion can be addressed. So with this, thank you very much for the patience listening.